We know that Steward has gone bankrupt. We know that several of its hospitals have already been forced to close their doors because they ran out of money. But the question that is interesting to me is, in the midst of all of that, how is the main person behind all of these efforts, Dr. Torre, how's he doing financially? And the answer is that he has been doing phenomenally well. While Steward was busy shutting down hospitals, the companies he owned received $250 million in compensation over a 4-year period. Let me repeat. He personally received hundreds of millions of dollars, some of which, remember, hospitals shut down, patients without care, workers being laid off, and some of that money he used to purchase this $40 million yacht. While Steward's hospitals were severely understaffed, patients were not getting the care they desperately needed. Dr. Torre was able to afford this $15 million custom-made luxury fishing boat. $15 million fishing boat while patients were dying. While Steward-owned hospitals could not afford to pay for life-saving medical supplies, it had enough money to purchase a $62 million private jet and, incredibly, a $33 million backup jet that Dr. Torre and his family used for non-business trips throughout the world. How many of Steward's hospitals could have been prevented from closing down? How many lives could have been saved? How many healthcare workers would still have their jobs today if Dr. Torre spent $160 million on high-quality healthcare at the hospitals he managed instead of a yacht, 2 private jets, a luxury fishing boat, and a huge contribution to a wealthy prep school? The collapse of Steward Health Care is just one extreme example of the damaging role, in my view, that private equity is having on our healthcare system. Private equity firms have bought up hundreds of hospitals, thousands of nursing homes, and tens of thousands of medical practices, saddling them up with unsustainable debt and stripping their assets to make huge profits for their executives and their investors. Study after study has shown that on average, when a private equity firm takes over a hospital, a nursing home, or another medical provider, the price of healthcare goes up, the quality goes down, and healthcare workers are asked to do much more with fewer and fewer staff.
We need to keep this from happening again. That means we need answers. And it seems the principal to give that answer is Dr. Ralph De La Torre. Unfortunately, Dr. De La Torre has refused to testify voluntarily. As a result, the committee issued a subpoena in July. Now, a witness cannot disregard and evade a duly authorized subpoena. Therefore, today, the chair and I will be asking the committee to report a resolution to authorize civil enforcement and criminal contempt proceedings against Dr. De La Torre, requiring compliance with the subpoena.
Our first witness is Dr. Torre. But as I think everybody can see, Dr. Torre is not here.
The corporatization and commodification of healthcare is the guiding ethos of Steward. It's the one and only priority. And it has led to horrific suffering and harm to our patients, the people who take care of our patients, and our communities. I spent 20 years working in the emergency department at St. Elizabeth's, and I can tell you we always struggled to have enough staff, enough equipment, enough supplies. This chronic understaffing has resulted in preventable harm and even death. We also have seen Steward fail to provide the supplies and the equipment that we need. Either the supplies don't come through the front door because we're on a credit hold and nobody will bring them to us. Also, our equipment it's not properly maintained. We have IV pumps and computers with battery lives of 7 to 10 seconds because the maintenance just hasn't been done. During my time in the emergency department, I worked nights. There were nights that we didn't have any Similac or Pedialyte or even diapers. I can think of 2 separate occasions where staff went out in the middle of the night to a 24-hour store to get those supplies. Also, we frequently didn't have food, kitchens locked up. And I personally have given my dinner, my meals to patients, and staff has chipped in and sent out and had food brought in for patients. Steward didn't pay the vendor, and there weren't any bereavement boxes. And nurses were forced to put babies' remains in cardboard shipping boxes. These nurses put their own money together and went to Amazon and brought the bereavement boxes. Probably the most tragic and what finally blew the lid off all this was the death of a 39-year-old woman who came to the hospital, had an absolutely normal childbirth. She may have been saved by a device known as an embolism coil. There weren't any in the hospital. There hadn't been any in the hospital for weeks. They had been repossessed by the vendor. She died. When a patient becomes less well or they die because the resources that they need were unavailable, that's greed. But for the greed of Steward in the way they deliberately, and it almost feels malicious, deprive me of my colleagues, my support system, my supplies, my equipment, I'm just worn out. We need legislation. We need safe patient staffing legislation. We need safe patient handling legislation so that the equipment is always available to move patients around. And we need safe environment legislation that would make it a crime to harm a medical worker.
Steward Health Care systematically extracted every possible dollar that they could get out of our hospital until it led to its closure 12 days ago. Under Steward, essential resources began to dwindle. Repairs that once would have been done immediately were put off and delayed. Sometimes they weren't addressed at all. Working under these conditions became overwhelming for everybody, nurses, doctors, anybody in the hospital at every different level. Due to the chronic understaffing and lack of supplies, it became our burden to try and make up for the financial strain that we were under. So we would keep that same level of care for the patient whenever we could by hiding the chaos that was going on outside and hiding all of the things that had to be done to get the care for that patient. And it was exhausting. It's already a very demanding job, and they made it almost impossible to do. The lack of overnight staffing in that ER has been ongoing. It was a known patient safety issue. Despite our local administration, our local hospital CEO, CNO, acknowledging it and wanting to support it and wanting to fill it, corporate, no matter what, they would just say no. Steward's abrupt closure of Neshoba with barely 30 days' notice has left our region without critical health care services. Our transport times for ambulances have doubled or tripled. Our local EMS systems are in no way going to able to consistently meet these needs, and there was no time to build up. They just said, nope, we're closing 30 days, that's it. The closure has resulted in longer waiting times for emergency care, for essential screening tests at other hospitals like mammograms, colonoscopies, all of those things. Now other hospitals are going to have to add all of our patients that were getting those services at Neshoba into these hospitals that they were already overwhelmed, especially in the emergency departments at the two closest hospitals to us. Moreover, Neshoba's closure has left the primary care physicians that are still in place with no place to send them for diagnostic testings like x-rays, CTs, ultrasounds, MRIs. They have to go drive a half hour to get, any of those services if they can get in for them. They portrayed us as a failing hospital with declining census to justify closure in the state, but the narrative conceals that the corporate executives have systematically deprived our hospital of essential resources for years, including not giving us consistent gastroenterology, general surgery, urologists, anesthesiologists, and as a result, Neshoba was forced to transfer our patients and for care that we could no longer provide. The steward's greed has put lives at risk, and their action is going to kill people. And it's left a complete hole in our community that, despite the warnings and pleas, nothing's been done to stop them. They have unchecked greed across the board, and it's not just a business failure, it's a human tragedy waiting to happen in our region.
We are going to pursue this. This is not the last discussion of this. And if Dr. Della Torre thinks that he is comfortable by not being here today, Dr. Della Torre, if you're watching, you're wrong. This will be pursued.